Hi, it's Tara here. Just giving you a Bell's palsy update. Let's see, I actually have stopped counting the number of days. I was diagnosed with Bell's palsy so today is May 11th, and I was diagnosed with Bell's palsy on July 7th of last year. So it's been about 10 months, a couple days over 10 months that I've had this. So yeah, I just wanted to do an update. I actually have a lot of things that I could talk about, so I'm going to try and keep it brief as best I can. But I definitely have some things on my mind and some things that I would like to share that I hope are helpful things for anyone who's also dealing with facial paralysis. And I do want to mention that I have Lyme's disease induced facial paralysis, which I've been calling Bell's palsy since the beginning, because I guess, to be honest with you, I don't really know the difference between Bell's palsy. There's Bell's palsy, there's Lyme's disease induced facial paralysis. Some people, like Justin Bieber, for example, get from, I believe it's from the chickenpox virus, I forget the name of it, Hunter's syndrome. Anyway, they all have the same clinical presentation, which is the face drop, the facial paralysis, the inflammation of that cranial nerve, that seventh cranial nerve. And maybe it's just different ways people go about getting to the same place. So I just did want to clarify, partly because I don't know if that could change, the recovery process, depending on what type of paralysis you have or the best treatment options. So I just wanted to be very clear that my facial paralysis was induced by Lyme's disease. And I know I've said this many videos ago, but I just wanted to mention it again. So yeah, so let's see. So real quick, as far as kind of where I am with recovery, I'm still seeing recovery. I don't really pay that much attention to it, to be honest with you, on like a daily or even weekly basis. Just every once in a while, I'll look in the mirror. I'm like, oh, that looks a little bit better. That looks a little bit different. I would say my forehead, the lines of my forehead are still continuing to slowly come back, especially kind of the lines up here. This area right in here is still pretty paralyzed. So I have no like eyebrow movement or anything. So this area in here, but I'm hopeful that this is just part of the healing process. So this is kind of coming back. And then ideally, the next thing will be this is coming back. My eye, again, I can close it now. And that I've been able to do for a while, which is great. I do still tape it shut at night only because, I don't know, maybe out of habit. Also because I can't blink my eye very well still. In fact, I still can't fully blink my eye. It still does get dry, so I'm still relying on eye drops throughout the day. And around like 6, 7 o'clock at night, when I know I'm not going to be seeing anybody else for the day and I'm just tired of doing the eye drops, I just will tape my eyes shut. So anyway, that's how I'm dealing with my eye situation. Though I will say I do think that the blink is, slowly kind of, improving. My smile, still not smiling much. And the synkinesis, which is like when I smile, when my eyes closing, when I eat, my eye will close. Let's see what else. When I blink, I don't know if you call this a blink. I can close my eye. It's just different. So there's a lot of weird stuff with my eye, which is very annoying. I'm not going to lie. And also I could just feel my face. My face feels like kind of numb. Even when I touch it, it has like not numb, but just almost like a very end of having had Novocaine feeling to it, and kind of maybe a little puffier than this side of my face. So anyway, long story short is that I am continuing to recover. I've come a long way since where I was in the beginning. I am going to continue to recover, though, from my understanding from talking to the doctor at the facial nerve clinic that I've been going to in Boston. Thankfully, I only live about 30 minutes from Boston, Massachusetts, so I'm very fortunate. I don't believe that there are a lot of places around the country or maybe even the world that specialize in facial paralysis, so I consider it a huge blessing that I do live so close. Which is why one of the things with these videos that I hope I can help people with is chronicling not only my journey with facial paralysis, but also my journey with various treatment options, which I'll get into in a minute, with trying to just basically cosmetically improve the symmetry and the look of my face and some of the stuff with my eye blinking. Gosh, where was I? I don't even know what I was talking about a second ago. All right, so real quick, I'm going to just give you, this is already getting too long, an update regarding my second appointment that I've had thus far since having this with the Facial Nerve Clinic in Boston. Dr. Jowett is the name of the doctor that I have been talking with. And so far, both appointments have been virtual just because it's been easier. But my next appointments, which I'll get into in a second, will be in person. So I took a couple of notes. Let's see here. Let me find my notes. Bear with me. Okay. So regarding my eye, so a few things. One, he said usually by about the 1 year mark, your face is kind of more or less, where it's going to be as far as its natural healing. There might be some continual healing, but it's kind of, you're in that like, this is kind of where we are and what can we do from here kind of situation. So that again, that'll be 2 months from now. So what I'm going to be doing is going to be happening in the next couple of months. So I did mention to him that it's annoying with having to use the eye drop still and my eye not fully blinking. So at some point, we'll most likely be trialing a titanium weight that I believe they surgically put into your eyelid that just helps to facilitate a little bit better the closing of my eye. And I guess people that have this issue really can get a lot of benefit from that. So that is something that might come up in the future at some point. And then obviously if it is not effective or if it's too annoying, they can remove it. So that's something that I'll be considering. And then the next thing that I will definitely be doing is some Botox procedures and some physical therapy. So the Botox, the way that this was kind of explained to me, is going to kind of paralyze, I don't know, there's basically with this synkinesis, there are, and I'm going to probably butcher this, so please, I am not a medical professional. So please don't take this as the Bible, what I'm telling you. But from my understanding, the synkinesis is basically there's muscles in my face now that are too tight and there's some that are too relaxed. And that's why you get all this funky stuff going on. I think that's kind of the way that he explained it to me. So the Botox, which is temporary, only lasts for a few months, but it should kind of loosen and tighten things the way they need to be done in order to hopefully get some of the symmetry back in my face. I guess maybe get some of the eyebrow movement again. I don't think they really know until they get in there how effective it is, but it'll be a good first start to kind of see how my face responds to these treatments and where we go from there. So that's going to be taking place in a couple of months, and I'll keep you posted on how that goes. And then the other thing that I'll be doing is some physical therapy. Up until this point, I have not done physical therapy. And the doctor, maybe 4 or 5 months ago, did say you could do physical therapy. I think he's being realistic with me in that it wouldn't hurt if I had that done. It might even help a little bit. But I think a lot of this is just a wait and see situation. But he did say that at this point, with some of the muscle tightness, that physical therapy would be beneficial. And I definitely notice the tightness. Like right now, my face feels kind of tight, but if I was to like even just gently massage it with my knuckles for a little bit, I could feel it kind of softening and feeling more comfortable. So that's probably something I could be doing on a daily basis anyway. At some point in this, you just kind of get used to it and you just don't think about it a lot and you go about your daily life. At least that's how I've been about it. And so I really haven't done, these kind of facial massaging type things. But anyway, so physical therapy and Botox are the next two things on my docket with the Facial Nerve Clinic. And then in the future, and we did not get too deep into the weeds with this, but it was discussed, there are surgical options, surgical procedures that can be done that are obviously permanent, unlike Botox, which is just temporary and would require me to continue to go in every few months to have it repeated if it was working. Whereas surgery is potentially, permanent. So basically with the surgery is they go in and they literally loosen and I want to say they mostly loosen muscles in your face to take away some of the synkinesis that's going on. So that would be something that we would consider in the future, as well as a procedure called, he called it the smile surgery, but it's called a functional muscle transfer, which is basically to try and get your smile back. And that gave me, I won't lie, it was a little squeamish to hear about what this would entail, which is basically cutting out some muscle in your thigh and doing an incision behind your ear and somehow replacing the damaged muscle in your face with good muscle from your thigh. He said that, I believe he said that roughly 70 to 80% of people get at least some level of their smile back with this procedure. I started to kind of ask some questions and he was like, let's just wait until we get, until we get closer. So I'm sure there's risks, as there would be with any type of a surgical procedure. So I think he kind of thought, let's just kind of not put the cart before the horse. But anyway, so I guess, does it stink that this has happened? That it's been so long that I've been dealing with this, that I have all this, permanent stuff going on? Of course it does. However, I am so fortunate that there are doctors out there that work with these types of things, that I have a lot of hope that as much as I feel the need to fix things surgically or cosmetically, that is an option yet to be explored. So anyway, I'll keep you posted on those things. And then on that note, real quick, as I want to wrap this up, talking about kind of, my mentality about this process. I'm sure some of you who are watching this are probably really early with dealing with this. And I want you to know that everything you feel, I could cry talking about this because it has been a very traumatic process. I'm not going to lie. It's been very hard emotionally. It's hard when the thing that you present to the world is so clearly not what you are used to. It doesn't matter whether you think you're gorgeous or you're not attractive. It's your face, and it is very difficult. It is everything, it's very painful. It can makes you very self-aware, obviously. And so that's all really normal. And so I just want to say that before I say the next part, that I want anyone listening to this to know that your feelings are normal, and you're entitled to them and they're okay. And yeah. However, what I will also say, and especially as somebody who's far along in this journey, is that this is building resilience. I truly believe that. I truly believe that what has happened to me is, despite it being negative, is actually really positive. I'm stronger because of this, and I have more appreciation for, even though my body has failed me in some ways, it's also served me in some ways and shown me how, and it's shown me what an amazing ability it has to heal. And yeah, I guess I'm building a resiliency muscle, and that's a good thing in life, to face challenges, because nothing is guaranteed in our lives, and anything can happen to us at any time. And in all honesty, in the grand spectrum of what could happen to me, this is like a drop in the bucket. This is stuff that doesn't impact my true deep health. It impacts my more superficial health. Even with the Lyme's disease, it was caught early. I don't have any symptoms like of chronic long-term Lyme disease. I'm so fortunate for that, because a lot of people do suffer from very chronic long-term complications from Lyme's, and I haven't, aside from, this stuff. And so, yeah, I guess just real quick, a few of the things that I think I have that are positives from this experience. One is I wrote a book. It's technically a manuscript because I haven't gotten it. I have no agent yet and it's not published, but I hope to get it published. And I kind of think, I don't know if I ever would have had the courage to write a book, if it wasn't for going through this, in a weird way. And so I kind of am like, wow, that came out of this, and, what else? I think it's also kind of stripped away some of my ego, this experience. I like to think I'm not a super egotistical person, but I have ego, and it's humbling to have a facial deformity. And so it kind of takes away, it almost forces you to just to be able to go out into the world, take away some of that like that I don't know, that ego about your physical presentation, and it just kind of it just humbles you. I don't know if I'm articulating this very well, but yeah, I would definitely say that's another benefit from this. And then again, just keeping things in perspective, just keeping life in perspective. And I guess the very last thing is don't not live your life. I guess maybe if I can close this up with any comment, don't not live your life because of facial paralysis. Go out there with your head held high. Be brave, be strong. Every time you go outside your house and you engage with people, even if you can tell that they're kind of like, oh, what's going on with this person? Don't feel like you have to tell them. I mean, if you want to, go ahead. I know sometimes, especially earlier for me, I'd feel this knee-jerk reaction to want to be like, this is going on with me. This is why I look like this. But you don't owe it to anybody, and you're okay. You're okay exactly the way you are. Um, so yeah, just for those people who are dealing with this right now, just know you're not alone. You're going to get through this. You're going to be better for it. You're going to be better for it. And that's all I have to say. Have a great day. Bye.